In this episode, UROONCO Prostate Cancer Chief Editor Dr. Marra talks to Professor Tilki on EAU Prostate Cancer Guidelines updates for 2025, specifically for high-risk, locally advanced, and biochemical recurrence.
We are here at the EAU TV UROONCO platform I'm Dr. Giancarlo Marra, working from the University of Turin in Italy. And today we have the pleasure to have with us Professor Derya Tilki from Martini Clinic Prostate Cancer Center in Hamburg, who's also Vice Chair of the Prostate Cancer Guidelines panel. So today we will give a brief update on what has changed and what is going on with prostate cancer guidelines. So welcome and thank you for being with us today.
Thank you for having me.
So the first question I want to ask, having a look at the press release of the guidelines that happened yesterday at the EAU, I saw there are changes in what is recommending for staging. So what are these changes? What's new?
Yeah. So with regards to primary staging, there's actually one change. The bigger change was the change from 23 to 24, where we clearly recommended performing PSMA-PET-CT for high-risk prostate cancer as primary staging. And for the unfavorable intermediate risk patients, we had mentioned CT and bone scan, and to increase accuracy to use PSMA-PET. But now in the latest version, we have it the same as high risk. So in unfavorable intermediate risk, we also state to perform PSMA-PET-CT. Of course, if available, and if it's not available, then do CT and bone scans. So that is basically the change, and it strengthens again the use of a more accurate imaging for primary staging.
Okay, fantastic. So we now have a PSMA that has been also implemented for unfavorable in intermediate risk, which reflects the wide use and of new generation imaging, and also all the studies in the literature that is pointing towards its increased use and its accuracy also. Okay, thank you very much. Another question I would like to ask is about lymphadenectomy. It's a hot topic. We will also have another discussion coming on at EAU TV. Last year at EAU Game Changer session, it was presented, let's say, intermediate term result of a trial from the Memorial Sloan Kettering Cancer Center, where patients were randomized to receive limited versus extended pelvic lymph node dissection. Results were quite surprising, quite astonishing, because there were no major difference in terms of BCR, but there were difference in terms of METs, despite, for example, number of nodes was similar between extended and limited, and despite other additional studies characteristics. Do the guidelines this year reflect this trial, and did something change in terms of lymphadenectomy?
Yeah, thank you for this question. So this was indeed awaited, with a lot of people ask us about it and ask themselves if we will change the recommendation. And as you know, there has been a big change from, again, 23 to 24, where we removed the recommendation of performing lymphadenectomy in intermediate risk prostate cancer, and where in high risk prostate cancer, we state that if the surgeon decides to do a lymphadenectomy, it should be extended, because that would be for staging purposes, because it doesn't have a therapeutic effect. And after this study update, which by MSKCC, which was published in European Urology also, actually we did not change this recommendation, because the study has some limitations, which we as a guideline panel commented in an editorial. So if the audience is interested in this is already online at European Urology. But due to the limitations we saw, this study didn't lead to any change in the recommendation. And the new update also shows no difference between limited and extended pelvic lymph node dissection in the primary endpoint biochemical recurrence.
Perfect. So it remains if you want to perform it, do it extended
in the high risk.
Exactly, but recommendations didn't actually change.
Exactly.
Thank you very much. Thank you very much for giving us this update on the guidelines.
Pleasure.
It was a pleasure to have you. And if you want to have more insights on guidelines opinion, you can read the editorial, or eventually we will do another conversation at EAU TV focused a bit more on lymphadenectomy.
Thank you for listening to this episode of EAU Podcast. To keep up to date with prostate cancer developments, visit our educational platform, UROONCO Prostate Cancer. For more EAU podcasts, please go to your podcast app and subscribe to our EAU podcast channel for regular updates.